Red light therapy devices. When it comes to red light therapy devices that are used in a professional setting, there's three main types. We have our beds, we have our pads, and we have our panels. So if you're watching this, you most likely have the beds or pads, but it's important to know the different types of devices out there and the pros and cons of them. And if you haven't purchased one yet, this is a really good thing to look into. Um, so at my business, we have both the red light bed and the pads. In this picture here, this is actually my trifecta light bed that I have. The pros for the beds are that they treat full body. It's more relaxing. There's more privacy, less treatment time is required, and it's easier setup and cleanup. So the cons are that it's definitely more expensive than the pads or the panels. I got a bed after I got the set of pads. So I first started off with a set of pads because it was less expensive. It's still pretty expensive. It cost me about $30,000. The beds can range anywhere from really 60 to over $100,000. Why I end up getting the bed is because of all the pros. So we had so many people who were interested in using the red light therapy in my business that the pads to be able to wrap people in them just got to be a pain. So to be able to show people that all they had to do was hit a button and get in was super easy. Made it a lot easier for myself, my staff, the patient, and the fact too that they could just go in the room, lock the door behind them because they're getting down to their bra and underwear, or they might be getting nude in there. It's just way more private. So a lot of pros to the beds, really. The pads, though, this is what I first started with. Again, I have the trifecta light pad system. This is actually my pad system right here that we've got. And the pros are that they're able to target full body still or spot treat certain areas. So what I like is you can wrap it around the body. We can go full body, or we can just target certain areas. That is nice. I will say I just had back surgery. And so while the bed's nice because it can hit full body easier, the pads have been nice because the bed, at least mine, is contoured. And so with the back issue, trying to get in and out can be difficult. And also with some of your people who are elderly, or getting them in and out of a bed can be difficult. The pads, therefore, it can sometimes be quite a bit easier to do for those individuals. So for me, getting onto the treatment table, much easier than getting into the bed because of that. So that's where I would recommend maybe the pads versus bed. And it's nice to have, for me, to be able to have both. I'm fortunate to have that. So the pads also have more LEDs and power than the panels. So when we're comparing it to panels, there's a lot more LEDs there. They're able to lay down and be more comfortable versus panels are going to be standing. The treatment time is more than the bed. So the pads were keeping people on for 20 minutes versus the bed is 10 to 15. These are moderately expensive, again, about $30,000. They're more difficult. Again, wrapping the body, you need a technician or therapist, someone to be able to wrap the body. Can be a little bit of a pain and fumble through it. It's really not that bad, though. You can usually do it in a couple minutes, but when you're seeing quite a few people or you need a quick turnaround time, it can be a little bit of a pain and a hassle. There's a little bit longer treatment time and cleanup time. So when you're getting people off and you got to wipe the pads down, it's easier. It's a little more of a pain than the bed to wipe down. So panels. This is a panel that I've got for home use. It's a Mito Red Light Pro. So these can vary. You can stack them. There's all sorts of different ones out there. They're definitely less expensive. Spending typically anywhere from hundreds to a few $1,000s. So a lot less expensive. So if you're on a huge budget, that's an option. Really good for home use though. So I'll recommend these for really individuals who want it in their home, or these panels. It's nice. Cons though, so definitely it's not as relaxing of an experience because you're typically standing. You can't lay down. You can't just lay down and zone out, which the bed and the pads provide. It typically requires the user to stand the whole time. I guess you could sit if you just were doing like half of your body, right? Or just say your face or something. You're only able to treat one side of the body at a time. So you're only able to treat front side or back side. So you're going to have to do one and then rotate. So it's going to just take a little bit more time. There's less power in LEDs per treatment area than the bed or pads. So when it comes to a healthcare professional setting, definitely I recommend the pads or the bed. And if you got the budget, you make it work for sure. If I had to pick one or the other, if you could only go one option, I'd go bed. Personally, that's my personal opinion. And with having both.